Question about Steri-Strips, how to retape after your tape is removed or it falls off. Okay, I'm Dr. Barrett, I'm a board certified plastic surgeon. I use a lot of Steri-Strips to hold incisions together. The main reason why is just like if you were to break a bone, you want to hold the skin together for at least a good 4 weeks so that you don't get these little micro movements and it prevents it from healing, or the body has to put a bunch of scar tissue in to kind of close the gap, all right? So if you imagine that this is a breast and this little blue line right here is the incision, we would use Steri-Strips in this fashion. I build basically a box around it and I cut this in half. This is a standard 3M half-inch Steri-Strips, and I will show you what I do here. First thing I do is I put the roof on, and normally I pull the nipple up when I do it. See how I'm pulling the nipple up? Boom. That prevents a lot of, infolding or indention of the incision if needed. Next one, I put the floor, and then I put the walls. All right. And what I found is that this kind of really holds everything together so that you don't get all those movements and your incision heals nice and neat.